The United Nations says the toll on civilians in Sudan has been horrendous, from appalling accounts of sexual violence and ethnic-based attacks to reports of mass graves, gang rapes and indiscriminate attacks. Among the horrors that could amount to war crimes, at least according to the High Commissioner for Human Rights, Volker Turk. A conflict that has already precipitated the world's largest displacement crisis and where catastrophic levels of food insecurity continue to emerge. Forcing officials here to describe Sudan as one of the worst humanitarian disasters in recent memory.
By the time the lean season arrives in May, people in some parts of Darfur could face what we term IPC Phase 5 level acute food insecurity. We call this stage a catastrophe. Malnutrition is soaring to alarming levels and is already claiming children's lives. A recent MSF report revealed that one child is dying every 2 hours in Zamzam camp in El Fasher, North Darfur. Our humanitarian partners estimate that in the coming weeks and months, somewhere in the region of around 222,000 children could die from malnutrition. And with the estimated, WHO estimates that more than 70% of health facilities are not functional. Children who are already malnourished are at even greater risk of dying from preventable diseases.
Worsunu warned the Council that their ability to reach the most vulnerable, most notably in Khartoum, Darfur, Kordofan and Al Jazeera states, continues to be severely obstructed.
Earlier this month, the Security Council adopted a resolution calling for full, unhindered humanitarian access in Sudan. Since then, I regret to report there has been no major progress on the ground. We do welcome that after revoking the agreement to cross-border operation from Chad, the Sudanese authorities announced on 5th March alternative routes, including temporary access via Tina crossing. The procedure for the use of this crossing are yet to be elaborated or put in place.
A position echoed by the World Food Programme.
More border crossings must also reopen to get aid into the greater Darfur region, which has recorded some of the highest rates of hunger and malnutrition. Border crossings operations are not the only solution, as they are considerably more expensive and time-consuming. Within Sudan, we also need access across conflict lines as a more cost-effective and efficient way to scale up our operations. We are also deeply concerned that hunger will spike even higher in the weeks ahead when Sudan's lean season arrives in May. Without sustained access and resources needed to scale up our responses, there is a high risk we will see IPC 5 level or catastrophic food insecurity.
He warned that if the international community were to prevent the situation spiraling out of control, coordinated efforts and joint diplomacy were both urgent and critical.
Rising hunger will only stoke instability across this region of Africa. So the international community needs to rapidly increase support for our emergency relief operations, financially and politically. Diplomatic efforts are needed to secure humanitarian access to the cut-off populations in Sudan now threatened by starvation. And fundamentally, this forgotten crisis requires political solutions to halt the fighting that is tearing the country apart. But we're running out of time.
The UN Humanitarian appeal for Sudan of $2.7 billion remains only 5% funded. They pointed to an upcoming high-level humanitarian conference in Paris on April 15th as an indispensable opportunity to make tangible commitments to support aid operations and address the suffering of millions. Funds that simply cannot come fast enough, as concerns grow that Sudan's crisis is globally being buried under the ashes of Gaza. Sherwin Brycepease, SABC News, New York.